Hi everyone. Sorry I can't be there today. I'm dealing with a lot of nausea and dizziness this morning, so I felt like it was best to call this one in and just to record a video of the presentation instead. I've sent off, just to be safe, I have this handout that kind of explains the policy process a little bit better, particularly how it integrates the reach streams and the advocacy coalition framework. I felt like it would be a little confusing just to discuss it. So before I begin, I just wanted to note that. The Supplemental Nutrition Assistance Program, otherwise known as SNAP and formerly known as the Food Stamp Program, is what I have discussed and wrote about. First, here's a quick overview of some facts just to get us started. SNAP is a type of redistributive policy that subsidizes the food and grocery budgets of low-income people, particularly those who meet income and asset eligibility requirements. This is housed under the Department of Agriculture, and the program is reappropriated every 5 years through the Agriculture and Nutrition Act, that's also called the Farm Bill. The program as we know it really began as a Great Society reform under the Johnson administration, right? And was part of many pieces of legislation meant to improve the living conditions of the poor, particularly in the Deep South and in urban areas. Today, millions of Americans rely on SNAP, but it does come with some restrictions, and that's most notably the work requirements on all able-bodied adults without dependents between the ages of 18 and 49. Who are required to work at least 20 hours a week or attend education and training programs, also called ENT. Most Americans are supportive of SNAP, and polls show that they're at least reluctant to accept cuts to the program, but on the other hand, they also tend to support reform efforts. For example, those work requirements and asset limits are something they tend to be in support of. Limits on sugary foods that you can buy. That's also something they're supportive of. Many actors are involved in the policy process for SNAP, and I wanted to use the Advocacy Coalition framework from Sabatier to kind of organize it a little bit better. So first, there's a clear food security coalition that emerges, which really supports making SNAP easier to access on the grounds that it's good for public health and it's better for people's public health. Members of this coalition tend to include Democratic members of the House and Senate Ag committees, and as well as a lot of nonprofits, the Food and Research Action Commission and the United Way. These are two groups that are into food justice, as it's often called. Note this group holds a very specific problem definition concerning hunger itself as the issue, which is kind of different than the way others frame it. Second, there's a food availability coalition, which this largely consists of the food and beverage industry. PepsiCo and Walmart are involved in lobbying for SNAP, and that's usually because they profit off of it. And finally, there's a reduced welfare coalition that emerges, which consists of the White House, the House Agriculture Committee, and the current USDA under Sonny Perdue. These actors wish to reduce welfare dependency and government expenditures, largely by cutting SNAP funding and increasing work requirements on able-bodied adults without dependents. Note this coalition holds a different problem definition. The problem is not necessarily hunger itself, but the problem with SNAP is welfare dependency and the economic strain that it creates. SNAP provisions leave a lot of flexibility for the states, particularly when it comes to eligibility and disqualification. So for example, states can use broad-based categorical eligibility for SNAP, meaning that income and asset limits are waived if you already receive another form of welfare, like Social Security, if you receive some sort of general assistance, if you receive TANF. These are the kinds of things that would waive your income and asset limits, and that applies in actually 42 states. More conservative measures include increasing disqualification periods for if you violate the work rules, eliminating all waivers on work requirements, that states usually impose in times of great economic turmoil, and narrowing categorical eligibility rules. Because of this, I believe the issue framing literature and our knowledge of three streams can really inform this discussion and can create potential room for policy development largely at the state level, since states control these. So, for example, policy entrepreneurs in the Food Security Coalition could tie the policy stream, which would be broad-based categorical eligibility, to the problem stream, which is public health, but also the growing gap between the rich and the poor, which a lot of studies show is a good way to frame the issue, and it gains a lot of public support. More conservative policy entrepreneurs in the Reduced Welfare Coalition could tie the policy stream, either eliminating work waivers that states can use, narrowing eligibility, or expanding disqualification periods to the problem stream, which is the growing size of government and welfare dependency. Both of these in the issue framing, or appear in the issue framing literature as issues that Americans really care about. So both of these plans could work at the state level, and it just depends entirely on the political context in the states. But there are some issues with the problem stream. For instance, there needs to be some focusing events. There were a lot of these early on in SNAP or in food stamp program. So, for instance, a lot of members of Congress in the 70s pointed to documentaries about hunger in the South, and these were actually credited with food stamp reforms both in 1971 and in 1977. And then further, the Reduced Welfare Coalition could really use a more identifiable story or narrative about welfare dependency, really what that means, or perhaps a report about its prevalence. But that's all I have, and thank you so much. I appreciate it.